Okay, briefly. Uh, yeah, it's funded by Irish Aid. It's a project with mainly two components. The first component is at regional level, and it's based in the principle that maybe the best way to learn is to learn with the good and the bad things that other countries in the region that face the same kind of challenges, that found solutions that might actually work also in other countries. And the philosophy behind is about sharing experiences and trying by this way to lead to advancements in the region. And this is one part. It's also about capitalization of the good things that are done in the region, trying to promote a change between countries, even the use of experts. Then a second component, because we thought that we could not only focus in the regional component, also you need to have a more in-depth presence at the country level, is that we are providing technical assistance to 3 countries in Malawi, Mozambique and Zambia in their own efforts to develop social protection floors. I think of course, if you have, for a matter of efficiency to start, of course, if you have each program with their own tool, I mean, each tool represents an investment, and of course, it's not a very efficient way of spending resources. And I was earlier talking about the lack of resources. There, of course, it's already an advantage, but more than that, you have the issue of coordination. You have the issue of how do you bring services together, and again, when you have lack of resources, it's also very important to ensure that someone who has a problem that might be solved by one agency, it can also be many times referred, for instance, for some other service that is available and is not aware. And there are costs involved also for people, I mean, in having access to resources. If they need to receive a payment of a cash transfer in one place, but they need to deal with like school uniforms or access to a program with school uniforms in some other place, and then to have a relation with the health service. I mean, all these are costs for people who are already extremely poor then many times. And I think of course it's very easy to see the advantages of having more harmonized systems, keeping at the same time, it's also still important to keep in mind that it's also different programs can have different specificities, different goals, and then it's important also not to fall in the other extreme of trying to, with one tool, to offer everything, or at least in only one way. There needs to be some flexibility within the tools, and that's what we have been trying to work also. I can put in a very practical question. If you don't have if you have a manual or a paper-based database in each locality, or even if it's a computerized one, but it's a standalone, it's hard for you really at the central level to know what is going on, and that's where you might have problems many times of corruption or of payments. It's very hard to check. I mean, by having, for instance, a central database where you can at the central level know what is going on in the field, of course it offers you a capacity to control what is going on and to reduce, of course, all the risks involved with the implementation of these programs. But also in terms of efficiency, you can allow you to use then, if you have a good database, you can also then use different payment providers, for instance, because they will not work with you if you have a paper database. Then there are many advantages of using IT. I mean, and it can also be the use, for instance, of cell phones to do payments in places, very remote places, where it will be very expensive to bring the cash, or it will be very expensive for the beneficiary to walk the distance to receive the cash. Then you need to innovate and use the available technology to make it easier for the beneficiary, but also cheaper and more efficient to the provider. I mean, for instance, the issue of the mindset is we have been, for instance, in Zambia discussing, but also in Mozambique, about, for instance, bringing the university to the process. I mean, like I said, it's a dialogue process. They don't tell you you need to do you can, for instance, add sessions just with the university, like we did in Mozambique, just with professors and students, and it was part of the process. And you can, like, in Zambia we are doing with parliamentarians now. I mean, if you do more dialogue, it's one way of dealing with these misconceptions, but you can also use other communication tools. You can bring, like we are doing the movies, we are even working in cartoons. I mean, you need to use all the tools that you have available. I think you need to have will to have dialogue. That's the first thing. They need really to believe that it's worth to, and it's not always easy. There's not always this culture of, and I see this changing. I think this is improving, but there is a little bit, sometimes people, there are some fears on opening the discussion, fears of being criticized, and also from maybe from the outsider, sometimes there is also already a misconception or a preconception that, oh, it's government, then it's something that we are criticizing, and maybe it's hard to bring everyone to the table, but to produce something constructive. Then I think it's sometimes to deal with these fears. That's what you need to focus, and then to bring. But if you bring the players to the table in a open space where there is space for critics, where there is space to construct, to build something together, I think it's very powerful too.